The Elements Massage brand believes massage therapists deserve a supportive team, business and marketing resources, linens, lotions, and the chance to learn as much as they want. So many Elements Massage studios offer continuing education too. What's better? They're hiring. To get your foot in the door, let them know we sent you by visiting elementsmassage.com/ABMP. That's elementsmassage.com/ABMP. As a massage therapist, you know that truly the world's most beautiful machine is in your hands. You help relieve the pain and pressures that hold your clients back from fully enjoying life. The CBD Clinic Massage Collection uses ingredients from nature to deliver strong, effective temporary pain relief with aromatic botanicals and natural emollients like CBD. Our tiered pain products let you personalize your massage to meet each client's needs. Be your client's hero by giving them the massage treatment of their dreams with CBD Clinic. Learn more at cbdclinic.co.
I'm Darren Buford.
And I'm Kristin Coverley.
And welcome to the ABMP Podcast, a podcast where we speak with the massage and bodywork profession. Our guest today is Dr. Joi Edwards. Dr. Joi is a licensed massage therapist and licensed physical therapist. She holds a bachelor's degree in Parks and Recreation, a doctorate degree in physical therapy, and has held her specialization in orthopedic manual therapy. She has extensive experience in the orthopedic field with both injuries and surgical conditions. She works full-time as a physical therapist, owns her own continuing education company, Alchemy Education, and successfully fuses the science of orthopedics with the art and intuition of massage, bridging both worlds together with the magic of silicone cups. Learn more at alchemymassage.com.
And I'm going to jump in here, listeners, because I have some very exciting news. Dr. Joi Edwards is one of the presenters at the upcoming ABMP CE Summit. She's presenting one of our self-care tips from the pros called Cupping, Self-Treatment for Carpal Tunnel and Bicipital Tendinitis. So be sure to tune in. The ABMP CE Summit is Tuesday and Wednesday, October 26th and 27th. 6 CE hours, 22 presenters. It's free for ABMP members and just $99 for non-members. Learn more and register at abmp.com/summit. Welcome to the podcast, Dr. Joi.
Oh my goodness. Thank you so much for having me. I am so excited.
Well, we are both excited to have you here. And you're our first physical therapist as a guest on the pod, which means you are definitely our first physical therapist, massage therapist combo guest. So I have sort of a chicken or the egg question for you. Which came first, physical therapy or massage therapy?
So I was a physical therapist long before I was a massage therapist. As a PT, I was never the type that said, do 20 of those exercises and 30 of those and then go home. I always like to put my hands on my patients. And it was just like the immediate feedback was like, wow, I feel better. And it made them want to do their exercises. And I was like, I got to learn this stuff for real. I was going off of intuition and I did what I thought was good and how they responded. But I was like, I have to go and I have to go to massage school. And so I did later go to massage school.
And how do you mesh and blend those two modalities with your clients?
So for me, I put my hands and my cups on almost everyone C, and then I supplement the hands-on with exercises, whether it be home exercise or exercise right there in the clinic for stability or flexibility or whatever our goal is. So whatever I cup for, if I cup to increase flexibility, then that's what we do. We do stretching exercises and flexibility exercises. And so they work seamlessly together, the massage, the cupping, and the exercise.
Dr. Joi, I am so glad that you mentioned today's topic, which is cupping. When did you discover cupping, and what was it about it that originally interested you?
Oh my goodness. So I was working part-time as a physical therapist at it was just primarily hands-on clinic. So they were a wonderful clinic, but they did just hands-on physical therapy. And I was filling in. There was a lady that had been seen at the clinic before, but I had never seen her. We were treating her for back pain. And I said, I'll be your therapist today. You go ahead and disrobe. I'll step out and give you some privacy. And she said, no, that's not necessary. So I turned around anyway to walk out or give her privacy. And she said, I'm ready. And so I turned back around and she had her back to me and she was covered like from head to toe in all these, to me, horrible bruises. And at that time I was fresh out of PT school. In PT school, along with like the science and they teach you have to be an advocate. You have to, there's an ethical responsibility that you may be the only one that's seeing this person and be able to, quote unquote, kind of rescue them from danger. So I immediately like put my cape on and I was like, oh my gosh, she's being abused. So I go into this whole spiel about, let's not do the treatment today. Let's talk. I can get you to a safe place. And so she was like, what? And I just keep on. I'm like, no, let's sit down. Let's talk. And she keeps pushing me away, like waving me off like crazy woman, do the treatment already. And then finally she says, it's cupping. I'm like, wait, it's what? And she says, it's cupping. And so it's enough to pacify me, right? So like we do the treatment, then I go home and I look up like what this crazy thing called cupping is. And it just intrigued me. It was just, I think, different from any Western type of therapy I was exposed to. And it started from there. I started researching. I went and I think I got cupped, and a lot of my friends are not from the United States. And so when I started talking to them about it, they were like, well, yeah, like, catch up. We grew up on that. We've been, introduced to cupping. My mother used to do it. My grandmother did. And so that was my introduction. That was my beautiful introduction to cupping.
Let's talk a little bit more about cupping for listeners who may have never received the work or have learned anything about it. Can you tell us a little bit about how cupping works? What is the theory behind that modality?
So with cupping, there's a negative pressure or suction, if you will, and that suction is used to kind of treat ailments or injury. Specifically, what I do is orthopedic injury, and so following an injury, a lot of times the tissues get compressed and they get tight and bound down, and with that limited mobility comes pain and dysfunction. So the idea behind cupping or orthopedic cupping specifically is to lift and stretch the tissues and just create mobility within the tissues. Kind of restoring that mobility helps to restore function and decrease pain.
And Dr. Joi, what type of cups do you use and why?
So I started off using the plastic cup with the pump gun, and I liked those. And then at some point I was introduced, or I decided to try silicone cups, and I fell in love with the silicone cups. So for me, I like to use, I treat primarily orthopedic injuries, sports injuries, or people come in with pain and a certain functional limitation. Like I have pain in my shoulder when I attempt to spike a volleyball, or pain in my hip when I go up and down the stairs. So for me, I like to move the cups around because I feel like it addresses the tissues better. And I like to move my client or my patient around in their functional, kind of dysfunctional movement pattern while the cups are on, to specifically address the tissues involved in their movement pattern. And the cups stay on perfectly with the silicone cups. They're easy for me to apply just with one hand. There's different sizes. There's different types of cups too. And I think that's my biggest draw. And I kind of approach it like I like food. So then, of course I'm going to use a food reference, but like a chef would with knives, like, like a butcher knife for like steak, or a butter knife, there's a specific knife for whichever meat you're cutting. And so for me, the cups are the same way. Like if I'm treating like plantar fascia or fasciitis, there's a particular like flip-flop cup that to me sticks the best at the bottom of the foot. But then there's also, I call it a plunger cup, where, it's literally like a plunger. And if there's maybe somebody that has that lordotic back and the tissues are kind of crunched and stuck in that area, I can use that cup and literally just lift up on the tissues. And so I lay all my silicone cups out, and depending on what I find on, evaluation after I put my hands on them, then I go and I use whichever cup is called for at that time.
Let's take a short break to hear a word from our sponsors. Anatomy Trains is delighted to announce a brand new dissection livestream specialty class on September 18th, Lumbopelvic Stability, a one-day layered dissection with Anatomy Trains author Tom Myers and master dissector Todd Garcia. The early bird price of $150 is held until September 10th. After September 10th, the price is $250. Come see the body's actual core for yourself. This course will be provided over Zoom webinar with multiple camera views, live chat, and Q&A. Visit anatomytrains.com to sign up. Now let's get back to the podcast.
Dr. Joi, when you were talking about your treatment therapy with cups, you talked a lot about movement, either moving the cups on the body or having the client move their body while you're cupping. Do you ever leave a cup in a static position? Do you ever sort of park it on the body?
So definitely, sometimes I do. Usually static cupping, I will. So if I've gone and I've kind of worked my magic with my hands and I've done some dynamic movement of the cups, but there's still one adhesion that's sticking its tongue out at me, I'm still here, you're not going to get rid of me, then I will give that little spot a little bit of, TLC, and I'll park the cup there and maybe go do some hands-on or cup dynamic cupping in another area, and then come back and see if that area has resolved a little bit more.
Okay, so if you are placing a static cup, how long do you leave them in one spot?
So everybody is different. So depending on what that client presents with clinically, if they have more pain, I'm going to leave the cup on for a shorter time, maybe 10 seconds, maybe 30 seconds. Again, it just depends on how the tissue is behaving. If that client, again, has a lot of pain, we obviously wouldn't leave the cup on very long. So I go upward to 3 minutes. If I know somebody like that, I've been treating some people literally 15 years, and I kind of know their body and their reaction. So I may leave it on a little bit longer, but justified in that I'm pretty sure I know that tissue response and I don't have to be terribly concerned. But I do go back and check the tissues often and reassess to make sure nothing crazy is going on.
Dr. Joi, is there a max number of cups you could put on the body at one time?
If you look at the internet, then no. There's some video with people covered head to toe. I'm oh my goodness. So ideally, you don't want to overload the tissue, right? So you put the cups on. It's like if one person comes and pulls on a t-shirt. Okay, somebody's pulling on my t-shirt. But if you have 300 people that are pulling on that same t-shirt, it gets overstretched, it's uncomfortable. So it's the same thing with the body, and that you don't want to overload the tissues with that tissue pull and that tissue stretch. I tend to probably at the most, and it depends on the body part too. I've done maybe 6 cups or so, but there's always a treatment hypothesis in my head. I'm not just putting cups on to put them on. If I can address 5 adhesions with 1 cup dynamically, so just basically ironing out the tissue issues, I'd rather do that than to throw 5 cups on that person. And if I am using, I gave the reference of 5 or 6 cups, I call it grating the suction. So I won't use it at 100% of what that cup can give me. So I won't squeeze the cup all the way and then put it on. I'll kind of squeeze it a little bit so that the suction is less, so that tissue insult is less and it's more tolerable for the patient, if that makes sense, or client.
Absolutely, yes. So Dr. Joi, the $1 million client question, does it hurt?
Not at all. No. It does not hurt. It's a different sensation. Almost everything is kind of compressive. Our socks, our shoes, even our clothes, there's a light compression on the body. The cupping is just very different. It's a negative pressure suction. And so it's a little bit strange to kind of wrap your brain around what you're feeling, because I think we're just not used to it. There's nothing that, short of a vacuum cleaner, there's nothing that you can put on the body to reproduce that kind of feeling. But no, it does not hurt. It should not hurt, no.
Let's talk about those marks. I can't think of anyone who doesn't picture that image of Michael Phelps after the Olympics when they hear about cupping and they just see that image with all of those red circles. So tell us a little bit more about what are those marks? Are they bruises? Do they always occur? What's happening with the body when that's created?
So definitely not bruises. Yeah, Michael Phelps did a lot for cupping. I think it was like 2016. Like my mom called me. It was like, oh, he has those circles that you had. I mean, it was like, wow. So there are several theories about what the cupping marks are, and a lot more research being done as to exactly what are the cupping marks, what's going on underneath the tissue. But so one of the biggest theories is the theory of stagnation, in that when somebody is injured, no matter a surgical injury, an orthopedic injury, an injury to the tissues, the body tries to heal itself. So the body sends like lymph and blood and cell debris and pathogens and just all this good stuff to the area to say, hey, fix this area. Left uncleared, when you put the cup on an area that has been injured, all of that cellular debris and kind of injury byproduct is coming to the surface. And so if there were severe tissue injury, it's kind of likened to severe stagnation of that debris. The cupping marks are indicative to me of tissue injury severity-wise. So the more severe stagnation or tissue injury, again, is that purple color. Kind of moderate dysfunction tissue injury is more of like a fire engine red color. And then areas that have limited or no tissue injury at all are just kind of fleshy and don't really discolor.
Dr. Joi, how long do the marks last on the body?
Marks typically go away about a week or so, an average about a week, maybe 2 weeks. Again, with the lesser stagnated injury areas, faster, but I usually say about a week and a half.
And for a massage therapist or body worker who's getting really intrigued about cupping, listening to this podcast, and I'm sure there are many, let's talk about, though, some of the contraindications. When wouldn't we want to use cupping therapy?
Contraindications for cupping are very much like massage therapy. One and the same. If it's contraindicated in massage, it would be contraindicated in cupping. Cupping is basically a massage in reverse, and you're affecting those tissues. So you just want to be careful. You wouldn't cup the same area every day. Usually allow 2 to 3 days in between cupping the same tissue. Now, I can cup your shoulder on Monday, and then you can come see me on Tuesday, and I could cup your leg. But I would not cup the shoulder Monday, the shoulder Tuesday, the shoulder Wednesday.
And that leads perfectly into our next question so that things don't go horribly wrong. What kind of training would someone want to receive about cupping therapy before they start working with clients?
Oh, I think with any massage modality, as much training as possible. I think schools are now doing a wonderful job at introducing cupping and other modalities prior to massage therapists coming out of school, which is great. For me, I think you need to take as many classes as possible in cupping therapy and from different instructors, because everybody has a different viewpoint, something that resonates with them. And they've hopefully been doing it for a very, very long time. And that too, I think you should be careful on who you take classes from. Someone that's been doing it for a week probably doesn't know as much as somebody that's been doing it for years and maybe not the safest. So just take as many classes as possible.
Dr. Joi, when we're speaking to therapists, often we're talking about rebooking strategies and getting them back in. What's the gap between sessions with cupping that you typically recommend?
If you came in and I treated your left shoulder, I would want about 2 to 3 days in between the next treatment session before I treated that same area. You just want to give those tissues some time to bounce back. Because again, if you attack this, if you cup the same spot over and over, that tissue becomes it's kind of like an overuse injury. It's water. What is it? The water that's dripping. I watch these movies, like one drip of water can drive a person crazy if it's allowed to continue on for a while. So it's kind of the same thing. You just want to give that tissue time to heal. So again, about 2-3 days in between time.
And Dr. Joi, is there a balance between how you do a cupping session? Does it involve hands-on work, or would that be a completely different session for you?
I combine it with hands-on. So the client comes in and they give me I'm here because my back is hurting or my leg is hurting. And so there's a subjective assessment for me. I want to know, where you're hurting, how much you're hurting, what happened. And in my mind, I have this hypothesis going the whole time, like, okay, maybe it's overuse, maybe it's a compression, maybe it's this structure, maybe it's that. And then once I am comfortable with the subjective portion, I put them on the table and I will do like a manual kind of assessment as I'm like applying my lubricant and doing my warm-up strokes. But the entire time, I'm going back to my hypothesis and I'm saying, okay, if it were a hamstring injury, I'm thinking there are likely going to be adhesions in that hamstring, maybe in the glute, maybe in the piriformis. So I'm literally trying to find these tissue anomalies, like something that doesn't feel nice and smooth, a little speed bump here. I call it, again, food. I like food. So I call it taffy. I'm like, oh, I feel a taffy there. I feel so in my head, I have this whole list. I'm like, okay, that was there. And it was about a nickel size. That was there. And this was a dime size. And so after I have my list and I work with my hands for a bit, and I feel like I've done a lot with my hands, or as much as I can do physically with my hands right now. Then I take the cups and I go over that same area. Because again, I start with my hands because hands are more compressive in nature. And I always like to end with the cups because the cups are decompressive in nature and our bodies like that mobility and it likes the space. So after I've done my hands on, then I take the cups and I'll go and I'll treat with my hands. I use the cups as an extension of my hands. So anything that I would do with my hands, like if I wanted to do cross friction with my hands, I would take maybe there's like a mushroom shaped cup. I would take a mushroom shaped cup and I would do a little bit of cross friction with that small cup too, because all I'm trying to do is lift and separate and break up those adhesions. So for me, it's manual, it's the hands on, and then I put the cups on. And the entire time, I have that list of say 10, tissue issues. I'm going back and checking those tissue issues the entire time to see, is the adhesion smaller now? Has it, I call it reduced in excitability, meaning when I poked it the first time, she jumped up to the ceiling. Like she wasn't happy that I poked her, but this time I poked her with the same pressure and she's like, whoa, that doesn't even hurt anymore. So I'm checking these things while she's on the table so that when she gets off the table, like the carryover is just, twofold. It's like, oh, it feels good. And I can now, go up and down the stairs, or I can sit, or what have you. I always put them in a functional position too. I should say that. So when my clients come in, nobody disrobes completely because I put them in so many different positions. So again, like if someone has trouble going from a sitting down position to a standing position, at some point during my treatment, after I've done my hands on, I've done my cups on the table, I'm probably going to cup them while they're sitting and standing as well, because that's what they came in to see me for. Most people don't come in when they first have pain. They come in because now they can't do something. Like I can't push my grandchild anymore. I can't reach into the cupboard. And so function is, we are a functional society. We have to function. And when we don't function, then it leads to other issues. You get sad, you get depressed. So if we can increase that function, improve that function, I feel like we improve that quality of life. So all of my treatments are functional while the cups are on. And then I take the cups off to see if we can now maintain still that same functional movement pattern now without the cups. And it's an eye opener for the clients too. They're like, holy smokes, I came in and I couldn't do XYZ and now I can.
I want to thank our guest today, Dr. Joi Edwards. For more information, visit alchemymassage.com. That's OWLCHEMY massage.com. ABMP podcast listeners, ABP members have access to more than 50 discounts through their membership. Services include discounts on continuing education, home utilities and cell phone service, legal fees, office equipment, and more. Go to abmp.com/discounts to learn. Thanks, Dr. Edwards, and thanks, Kristin.
Thank you so much for having me.
Dr. Joi, thank you so much. And listeners, if you were interested, and I'm sure you were, in the information that Dr. Joi was sharing, please check out her presentation during the ABMP CE Summit. Learn more at abmp.com/summit. Members are loving ABMP 5-Minute Muscles and ABMP Pocket Pathology, 2 quick reference web apps included with ABMP membership. ABMP 5-Minute Muscles delivers muscle-specific palpation and technique videos, plus origins, insertions, and actions for the 83 muscles most commonly addressed by bodyworkers. ABMP Pocket Pathology, created in conjunction with Ruth Werner, puts key information for nearly 200 common pathologies at your fingertips and provides the knowledge you need to help you make informed treatment decisions. Start learning today. ABMP members log in at abmp.com and look for the links in the featured benefits section of your member homepage. Not a member? Learn about these exciting member benefits at abmp.com/more.